Hello everyone, I'm presenting our work, Doctor's Eye, the design and evaluation of a video conferencing system to support doctor appointments in home settings. We are from Connections Lab at Simon Fraser University and McMaster University. In recent years, we see the proliferation of video doctor appointments. Patients can see family doctors in the home without the need to visit a doctor's office. It saves traveling time and waiting time in the clinic. However, it's not entirely clear if such applications can meet patients' needs of seeing doctors. A doctor's appointment could involve varying types of exams. It could differ a lot from other contexts, like meetings in the workplace, or casual conversations with family or friends. Prior work used different ways of camera work to show human body or interact with remote people in a home setting. Building upon these work, we explored how to overcome patients' interaction challenges in both technical and socio-technical aspects that emerge in video doctor appointments. First, we conducted a participatory design study to identify design factors important for video appointment systems. We recruited 6 patient partners from ReachBC, a platform to connect patients and health researchers. All of them had video doctor appointment experiences, either for chronic or occasional health issues. They had professions in healthcare research, product design, social services, and community volunteering. The workshop was organized virtually because of the COVID. It included 3 sessions. First, identify research questions, goals, and hypotheses. Then, generate design ideas. And lastly, refine designs. Session 1 was to help patient partners understand challenges in the use of video chat for doctor appointments. 4 main challenges were identified, including examining different body regions, capturing body actions, conducting sensitive exams, and managing privacy issues. To address these challenges, we proposed 4 clinic scenarios in Session 2. Patient partners were encouraged to brainstorm design solutions. The process helped us propose 3 potential systems. The first system was a combination of a handheld camera and a monitor. The second system used a drone camera instead. And the third system was a telepresence robot. In Session 3, we asked them to evaluate how these 3 systems can be used for different medical situations. Eventually, the solution of using a handheld camera was selected. 4 main design features were generated, including decoupled camera and display, free capturing, hide my camera view, and virtual cover. Decoupled camera and display helps patients capture a view of their body using an external camera and see the video stream on the phone. They can always have visual feedback when moving the camera around, for example, when shooting body parts that are out of their direct view, like their throat or back. Free capturing allows patients to put the camera on a table or attach it to any other surfaces, like a wall, without the need of holding the camera in their hands. This could be helpful, for example, when performing body movements that occupy both hands, or when the patient must be at a specific distance from the camera to show their entire body region. When Hide My Camera View mode is on, the video stream sent to the doctor is disabled. Only patients see what the camera is currently showing. This enables patients to align the camera into a proper pose until they are ready to stream images to the doctor. By selecting a part of the camera view with the virtual cover feature, patients can limit the area that the doctor can see. A slider can adjust the rest of the camera view from transparent to completely opaque. The algorithm ensures that other body parts are kept hidden even when the camera moves. This approach aims to protect patients' privacy in that they can show the doctor only the parts that are truly necessary for assessment. To evaluate the system, we conducted a qualitative study to explore how the doctor's eye can be used in various medical situations. We recruited 18 participants from Metro Vancouver in Canada. They were required to be familiar with the use of smartphones and video chat. We created 5 scenarios, including diarrhea, sore throat, chronic pain in the knee, chest acne, and post-surgery recovery. Participants were expected to use these features differently in each scenario. Participants were situated in a mock home space in our research lab. A room divider was set up to separate the interviewer and participants so they could not see each other during the mock appointment. After each scenario, the interviewer returned to the mock home space and interviewed participants. Then I introduced the main findings of this study. First, the separated camera and display design allowed participants to see what is being captured when the camera was posed out of the range of their vision. As this participant said, "I think if I brought a phone closer then I won't be able to see the screen. So now, since it was separate, I could bring it as close as needed." Despite the benefit, participants found challenges when coordinating 2 devices simultaneously. They preferred to operate only one device at a time, because viewing and talking to 2 devices could be confusing. As the participant said, "One problem I'm facing now is, do I look into the camera, Or do I look at the screen? So like I'm switching between both. We also found that some participants tended to use less effort to pose the camera. In this case, this participant left the camera on the table while trying to fit his leg in the camera view. Like this participant said, "So, I mean, you could do this too. Whatever you feel more comfortable with, that just came naturally to me, because I have this sofa and I could do this." Participants also talked about challenges around coordination. For example, they were not aware of what the doctor needed to see, not aware of what a right location was to place the camera, in terms of where to place it, which direction to orient it, and how far away to place the camera. Like one participant said, "I couldn't get the guidance that clear. Okay, should I move left? Right? Should I go in or out? Or like, how should I go?" To improve the coordination work, distributing camera control to the doctor were supported by participants. But design challenges remain in what types of control to hand over and how much control to give to the doctor. Participants preferred the doctor to focus on their body only, not elsewhere. They hoped they were able to manage the camera access and supervise what the doctor was looking at, to assure that the doctor was not looking at something inappropriate. As one participant said, "Well, if I could see the picture of myself, like what exactly is he zooming into? Like what exactly does he see? I think that'd be good for the patient." Seeing oneself on the display might raise concerns of self-image management. Showing any other part of their body other than their face was not what they normally did in a video call. As one participant said, "So seeing an up-close camera and it was now focusing on my teeth, on my tongue and everything else. It was a very different angle of my own face, of which I wasn't very comfortable seeing that." Participants thought that the virtual cover feature could help them hide what was not necessary to show to the doctor. But they also thought the feedback was confusing when the hide camera view or virtual cover feature was turned on. It could create an illusion that the doctor can still see them, with the rest of area darkened. As one participant said, "I was also imagining that the doctor is able to see that much area, but only slightly dark. So I wasn't sure if the doctor was not able to entirely see it. But if I were not to read that prompt, I'd feel that the doctor is also seeing exactly what I am seeing." This study suggested a few design considerations for future work. First, technologies can be created to better support patients showing the body regions they intend to, and meantime, they don't have to take much effort to see what is being captured. Future work may also consider reducing patients' workload by distributing camera control to the doctor. However, this needs careful design to protect patients' privacy from being compromised. Future work might also explore what types of camera view feedback could be easier to perceive when the patient's camera view is different from what the doctor sees. The interface design may also think of managing patients' self-image, so they could feel comfortable with showing body regions over video. The study also has limitations. We did not involve doctors and broader populations in the evaluation study, and did not conduct actual video doctor appointments. To summarize, this work contributes insight on how to design the camera work to support examining patients' bodies, and an understanding of how participants use the novel interfaces in showing their bodies, as well as how this can inform future designs. Thank you. Hello everyone, I'm presenting our work, Doctor's Eye, the design and evaluation